Today we'll be talking for the next hour on locum consultant, an overview, and own experience. So we'll start out describing who the panel is, myself and Dr. Aisha, and then we'll talk about our disclosures, and we'll split. Dr. Aisha will give you a few minutes about how the medical specialty looks like as a consultant. And then I'll give you a bit of a taster on the surgical specialty. And then we'll open the questions to the floor.
Yeah, thank you.
Dr. Aisha, through to you.
Thank you, Mr. Ahmed. Thanks for the committee for inviting me for this conference. Actually, as a speaker or as attendance, I have gained a lot of information. It's a very comprehensive one. So with no more delay, I think that there is different background from the medical and surgical point of view, and I believe that medical one is much more easier to come as a consultant. I'm talking about a locum fixed term consultant as a first job in UK. I believe the surgical one would be a very, Mr. Ahmed will talk about it, but it's more difficult than a medical one. First of all, who should come to or why? I think, Mr. Ahmed, if you get the slides of which consultant or who can come to as a first one to UK. First of all, why you have been already most likely is working at your home country as a consultant or at least senior level. You have been already on a structural training, you have finished your structural training. So you have been working, let's say in tertiary hospital in your home country with, because working as a consultant in UK, it's a risky and challenging job. Very stressful. It's not like those who, I don't have an experience in Egypt actually, but those who have been working as a consultant in a Gulf area, this is a little bit different from there, unless you have been working in a tertiary hospital with a structural program in Saudi Arabia or anywhere in the Gulf area. So you have been, for yourself, you should be already in a senior level. It's not only about the medical knowledge, it's also about administration. You have a lot of admin work. You will be observing the juniors. You'll be engaged in the teaching, and you had a lot of, if you don't have this experience before coming to UK, it will be very challenging and risky getting the first job as a locum consultant in UK. So first of all, you have to be confident. You have to have the knowledge, the medical knowledge. And there is another part from the hospital itself. I will prefer saying that it should be an IMG friendly atmosphere and support from the hospital side or the trust side, because you are in the top of the pyramids. You have the one who's given all the junior will come you for the decision. It's your decision and it's your work. Sometimes it's difficult for someone who have not known the system in UK to come before it. So you have, before applying to the job as a consultant, you have to have done your own homework, let's say, and read exactly the job description, what you are applying for. If you felt that you are not fit in this job description, you don't apply for a local consultant job, even if you are a senior or a consultant in your home country, because it's different. You have to go thoroughly through the description of the job, exactly what they requested for. Usually for someone who's coming in, and it's more easier for a medical, because we are not, don't have a lot of procedure like the same in a surgical. So they are more, let's say, an easy way to accept a medical consultant rather than a surgery from outside UK and overseas. You'll always be under microscope looking for you as, do you have really the same equivalent as those who have been trained in UK? So you will be always under stress, or let's say in the first few months from starting the job, because you need to prove yourself you are there. You need to get for a new system. If you are not one of the, let's see, the characteristics that was able to ongoing progressing of treatment, of teaching and gaining information, learning again, so it will not be the best job for you to start as a local consultant. we'll go in details while we're going on. So, Mr. Ahmed, if you would like to add anything here in these points.
So moving on to a surgical perspective, surgery is a bit different to medicine, and different specialties vary. And you need to be very wary of the supply versus the demand for your specialty. And in some specialties, you can have, for one job advertised, about 75 applicants, 25 of whom are absolutely fantastic CVs. So the chances of getting a job in such a specialty are very low, like in cardiac surgery. So not getting a job in such a specialty doesn't mean you failed. It just means the pool is so tight and the demand is so low that you're unlikely to get a job, not because of anything wrong in yourself, but it's just the way it is. After you get your first job, your first 18 months are crucial. Why? Looking at the stats, the first 18 months are the commonest period where you're going to be striked out and you're going to be withdrawn from your GMC registration, or you lose your job because of any errors. So you need to be very careful. If you've got a mortality, for example, you're doing a CABG, then it is not unusual for a surgeon to come to his colleague, if it is a friendly environment, and tell him, listen, I've got 2 mortalities. I can't bear another mortality, and this patient is high risk. Can you take him on? And this can happen from a consultant that is 10 years experienced plus. It doesn't matter how many years it is, because if he gets a higher mortality, he will be investigated. And vice versa. If you're starting off and a colleague comes to you and tells you, can you do this triple valve operation? Or can you do this sleeve pneumonectomy? It's very, very acceptable to say, no, I'm sorry. It's out of my remit. You need to know your limitations and appreciate them. Yes, you're keen to progress. Yes, you're keen to do great operations. But if you get struck off, you won't be doing even the minor procedures. Medicine versus surgery. Just to give you an idea about how aggressive things can be, and hopefully, inshallah, it won't be too bad, but 15% of the cardiothoracic surgeons are stopped from operating and under investigation. Our president, our SCTS president, is stopped from operating. He's a senior surgeon. He's got years and years of operating, and at the minute, he's not allowed to operate. So however senior you are, however great you are, you can be scrutinized. So be careful. Proactive versus passive. So this is the next 3 points are very related to each other. You keep hearing this advice, keep your head down, keep your head down. That doesn't mean you don't operate or you just do straightforward cases. No, if you're confident in progressing, go ahead. If you want to do some research, go ahead. If you see that the unit can benefit from something, be proactive, that's fine. But the thing is, you need to appreciate your limitations, appreciate the time, and appreciate the environment you're in. And it varies a lot from a small hospital, a small unit, to a large unit. And things can be very variable. And you need to have that common sense to judge what is needed. How can I benefit this unit? And how can I progress safely? Non-clinical avenues. So you also need to not just be a surgeon, you really need to help out with other activities if you can. And most consultants will look into one of 3 avenues: teaching, management, or research. And everything comes step by step. If you've got a university next by, or if you've got a research center in the region, you choose what is available and go down that avenue and plan for yourself. A lot of surgeons think that once they've got a consultant post, that's it. And they stay where they are for years and years. I don't think that's the right thing. And I had an advice from one of the senior consultants that I worked for, that I have great respect for. He told me, you have to plan. You have to have something in mind. And that's exactly what I did from day 0. Sometimes you succeed, but other times you don't. But that doesn't mean you don't progress with a plan to build yourself. and to progress. So, for example, myself, I've been a consultant for 4.5 years, coming up to finishing my fourth year. Sorry, 3.5 years, coming up to finishing my fourth year and starting my fifth. If you look at the things that I succeeded in doing, a lot of them are related to teamwork, not just me. It's a lot about the people around you, the managers above you, and how you deal with them and what is required from the unit. I started in the smallest unit, smallest thoracic unit in the UK, and they had certain challenges at the time that I started, very, very aggressive challenges and threatening challenges. And the managers were very keen to look after the unit. So I suggested to them starting robotics, and initially they were very reluctant, and they waited for a year to see my results and to see how my patients survive and the hospital stays and other aspects, and to make sure that I can progress with the robotic program. After that, they did start to approach me, and they did start to support me in the robotic program. And alhamdulillah, now we are the only and the first thoracic robotic program in the West Midlands. After pursuing that, I'm looking forward to doing some research. Started to contact some of my previous consultants to see how I can do some research. I've registered myself as an investigator for 2 nationwide studies, and we'll see how that goes. Administration-wise or managerial-wise, I've found myself to be the only person available to fill this vacancy. This doesn't really take from me much time.
I would just add a few questions. Did you, sorry, Dr. Habib, did you finish your talk?
No, I just skipped the slide by mistake. Okay. So filling in the post of a board representative really doesn't take from me much time. But all of these aspects fill into your CV, and you find that you're building yourself, you're progressing with your career. You've not stopped when you've got your consultant job, and everyone's happy, and you help the junior consultants coming after you. You build things together. Don't stop them from progressing, because even if you have the power, later on, they will see something weak in you and they will criticize you. And a lot of the people that have been put under scrutiny and investigations are due to complaints internally. So try to be nice to your colleagues. Do not overrule them. Have a nice environment, a healthy environment. If your colleague needs some help, go and give him a hand. Stay back at night. That's not a bad thing. That's a very good and healthy environment. And don't forget your family. So on the right-hand side, I'm starting a hobby, looking after my family, looking after my kids, because if you don't have a good environment at home, you will struggle at work. And a lot of even the national trainees fail to continue their programs because their social life is destroyed. I think I've taken a bit too much of my time, and
I'll just comment speech, Mr. Ahmed. So for the one when you said about the teaching, that's what I'm saying about being a consultant is not the end of the tunnel. Actually, it's the starting of it, because it's a dynamic job. You need to continue working on yourself plus helping others. So it's a balance between ongoing learning by getting more, as someone we're going to observe or supervise to a junior for the teaching, he himself or she herself should be able as well to gain a teaching certificate from here or courses. So you have to ongoing and work on yourself for the courses according to your specialty, whatever is being engaged in audit and research. And for a medical point of view, I believe this should be in your plan from day one. So the planning is first of all before coming. Not obtaining a job as a consultant in UK is just no. You are just starting the challenging. You are just starting the adventure actually toward this, because the next question would be where I'm going to start this consultant job. I don't think you would be able to jump for a tertiary hospital in UK from day one, because it depends on the market, and usually you will come as from overseas as a first job as a locum consultant for a shortage. So they are filling the gaps by, it's a two-way, the hospital needs you to fill the gaps and the shortage they have, and you need them because you need to fill if you are planning for a Caesar or for a specialty registration, or if you want to continue just only on your general registration as a locum. So this is ongoing dynamic job, and you need to change maybe your plan every now and then. So from day one, you should have a plan that within this year, I should achieve so and so, whether this is a teaching, so this is a research, being an examiner, and from an experience point of view, although I had previously have been an examiner and in a teaching position before, but I had again to go for a courses to teaching and to be, before starting to be here an examiner on the college, I had to go for a course to show them I can work an examiner. So it's ongoing challenging, ongoing stressful condition. If you are not the kind of person who can work this, you shouldn't apply for a consultant job from the first job, even if you are a specialist and you have a high experience level. Where to go? I think we did not discuss this. I starting your job at least in, let's say, a district general hospital, what I did myself. And each one of us have a different experience from the other. So it's not like a one route or one pathway for each one. It's different. So each one have a different experience, and success itself had a different experience and different tools to reach it. So where to go? I believe you should start it in not a very busy hospital. So at least you get to know the system, or at least that's what I did, to get to know the system, have a supportive team from the hospital, from the trust, getting to know the environment, and then you start looking and re-evaluate your experience. Was I in the right position? I need to be safe, I need to know the system, and I need to progress in my career as well. So was this the proper job for me? Do I need to step down? Do I need to hold and move further? Do I need to stay in my place? Because most of those, or at least this is my experience, who came from overseas as first job consultants, they will get the fixed term locum consultant as 1 or 2 years. I think Dr. Rabia have spoken about this. So they will re-evaluate you, that you have 2 years locum consultant. Either you go for specialist registration by doing the Caesar, or that's it. So you have to move for another hospital, or you have done your Caesar. So from day one, you have to know what are you planning for, what is your plan, what you are aiming. Are you just aiming for your family to settle down in the UK, so you don't bother yourself about Caesar or specialist registration, and you will continue for number of years of your general registration with locum consultant from hospital to hospital? Or you want to go for specialty registration, so you work on your Caesar, you work in your medical work, covering your clinic, teaching, doing audit, doing research, and progressing your career to do your Caesar pathway for specialty, and then substantive consultant job. This is a lot of co-factor events in each one personalized circumstances, let's say. So where I will say from small hospital or general district hospital, and then re-evaluation experience, where do I want to go for a higher, for example, hospital, where it can support me more, filling my gaps for the Caesar, and I can fill the gaps for the shortage of the jobs they need to fill that. And then from there, you decide if you want to go for a Caesar pathway, you want to continue there as a locum, and so on. So yeah, this is what I wanted to just comment on it.
That's brilliant. So should we, I think there's already a question. So Dr. Mahmoud is, let me just, yep, stop sharing the screen. And Dr. Mahmoud, how can I judge myself to come for the first time to the UK as a locum consultant, or no? I'm interested to join as a locum consultant, and I have enough experience and certificates to do so. I'm really afraid because of the huge opinions not to do so for the first time, although the colleagues who came as locum consultants from the start did not discourage. And he is a nephrologist. So I'll leave that to you to answer.
Okay, so as I have mentioned already, it's Dr. Ahmed who said. So
Dr. Mahmoud.
So Dr. Mahmoud, sorry. So again, it depends on yourself. How long have you been on a consultant job as a nephrologist? How you need to contact people who is working as a consultant nephrologist. What are their job description? You need to look for the job description. Let's start with an NHS job, for example, and you look for specifications, what they are requiring from the nephrologist as a consultant. Are you able to do the same requirements that you're asking for it? Are you able to, which I think a lot of nephrologists have speak today in the meeting, but you need to find out, are you meeting the same criteria they are asking for? Or if you are meeting for the same criteria, then apply for it. If you have the enough confidence and you can practice as a safe and you have environment which supports you, you can come as a local consultant. A lot of people would be afraid, but I did my homework before I came, and I found that more or less I'm doing the same as doing for a hematologist. I'm a hematologist, and the only difference for me, or the challenge I faced when I came, was the administration work, which was a little bit different. But as I was working in a tertiary hospital, I did not face a lot of difficulties, to be honest, and maybe I was lucky. But that's why I choose to start in a general district hospital rather than a tertiary hospital. A tertiary hospital, if you wanted to go, for example, for where, and I'm not a nephrologist to advise, but if you want to work in a place where, like, there is a renal transplant, for example, I don't think they will accept you as a consultant from day one, but you can just go there as a registrar and then show yourself and then upgrade. If you go for a general district hospital, you can start as a nephrologist. And I know my colleagues who came and worked as locum in general district hospital. So it's not difficult to find one.
I just need to make a note here. The people that are scaring you from coming, it's not about your clinical level. You may be a lot more knowledgeable than a lot of people here. It's just about knowing the system, making sure you don't make silly mistakes. And generally speaking, in the medical field, colleagues are usually supportive, and you will find at least some, if not most, of your colleagues ready to advise you and tell you, no, avoid that and do this. So inshallah, I think you should proceed. I think you should invest in some time coming a bit early and visiting the unit and saying hello to people. I appreciate from abroad, it may be a challenge, but you may book your tickets a bit earlier if you get the job and come and spend some of your own time in the unit. I think we'll move on. There's Lamis Sharaf. Lamis Sharaf, yes?
Yes, please. Yeah, just need to add something. Thank you so much for the lecture and for the input from Dr. Eisha as well. Yeah, she did really very well. But let me just say some tips for some people. Not everybody like the other. Some people can accommodate high stress and work accordingly, and some people a little stress could be trouble them. So every person is different. So I myself couldn't advise anybody to tell straight away to a higher job for this reason, because I have seen, I'm sorry to say that, because I have seen many colleagues they are doing very good in their job back home, but once they come here and they did the lab test and everything, but there is some frustration on their job. So I prefer to go into lower grade job rather than higher grade job. Thank you so much. This is my opinion. Thank you.
No, that's fine. We accept that. And I think it's been mentioned a lot by our colleagues as well. Dr. Eisha, would you like to add anything, or should we?
No, I was just saying that's what we mentioned in the beginning of this session, that it differs from someone to other. It does not, nothing is suitable for everyone. So yes, everyone have assess and be honest with him or himself before applying for the job. I'm confident enough, I'm doing this job enough or not. And or again, the co-factor from the hospital and the trust is very important.
Yeah, thank you so much. I wanted to emphasize it only. That's all. And well done in your job. Thank you.
Thank you. Dr. Aukesha, Mohammed Aukesha.
Sorry, I just lowered my hand because I think the comment has been said by Dr. Lamis. I had an example of what Dr. Lamis said. Is a colleague of mine who very well trained and probably higher trained than me and than most of my consultants I've worked with in the UK. So that can tell you the level of how good is he. And he applied for a registrar job in one of the busiest center in the UK, and unfortunately he was broken by the experience. So it's very variable. I stopped advising people to or against a specific job. It's very, very variable. He could come as a consultant in a very small unit and he can survive, or he could come as an SHO in a very busy unit and he can collapse. So it's very, very variable. But that doesn't assume his level rather than the busyness of the center.
That's true. And I'd like to just add a few points here. Now, it's very important that when you come to a new country, it's a completely different environment. It's a completely different. And if you get broke after 6 months, it's fine. You can start in another unit. It doesn't matter. It doesn't matter. So it's fine to always. I mean, actually, the usual pathway is to fail on your first job, and that's absolutely fine. And when you don't make it on your first job, that doesn't mean you're bad. It just means go ahead and try again.
Yeah, I agree with you, Mr. Ahmed, and that's what I'm saying. It's different from someone to the others because there is all the new challenging of moving for a new country, new system. And it's beyond the scope of today's session, but sometimes one will come without his family first, adopt the situation, get to know the system, and then bring his family in 6 months' time. So while this is beyond the scope, we're just talking about, can I come to UK as a first stop as a consultant? The answer is yes, but there is a lot of factors can affect your decision of coming as a consultant or not. This is including a personal factors and the hospital environment factors. So there is no answer, and as Mr. Aukesha said, it's variable. It's something absolutely no one can say there is one pathway for each one. My own experience was successful, alhamdulillah. But again, this is not suitable for everyone to go for it.
Okay, something else, especially for those applying from abroad or applying internally for very competitive jobs. Now, when you don't get shortlisted in an interview for a consultant post, you need to think how you can shine, and you need to think like the panel that is shortlisting you. Yeah, most of the jobs are applied for by the track system, and when the panel downloads your CV, they download them. For example, if there's 10 applicants, they download the CVs, come straight after each other, applicant 1, 2, 3, in a whole sheet, and they get a whole pack just like that. And the applicants are one sheet after the other, and they will not give the shortlisting more than 10-15 minutes of their time. So all of us have fantastic CVs, all of us have publications, all of us have operated, all of us have management courses, this, that, the CVs are there. So one of the things that I found very useful for my CV was adding my outcomes. And that took me a good 7-8 hours of hard work to withdraw the outcomes and put them in curves, graphs, and plots. And my CV was approximately 25 pages. Half of it was my outcomes. And when I did that, I was shortlisted in all the jobs but one, where they did not shortlist me because they wanted to protect their internal candidate. Okay, so you need to make your CV shine. You need to make them say, yes, this is the one I need to see. Yeah, it needs to look different. That will get you a shortlisting. It won't get you the job. In the interview, that's a different ballgame. So you need to think and you need to benchmark it against something. So for example, you can have a look at my CV, it's online. Yes, I've taken out the numerous pages and I've cut it down to half, but you can have an idea of how I put down my outcomes, how I benchmarked it against the rest of the UK outcomes, comparing mine to the trust, to the UK. And it looks nice. It gives an idea to the panel. Who am I appointing? Okay, yes, he can operate, and these are his results. So this is what I'm buying. Yeah. So it's a market, demand and supply, and you need to shine. There's a question in the panel. If I come as a locum, it's the same, Dr. Mahmoud. I find myself not fit for it after a while. What's the best way to step back or withdraw from the job to minimize the losses? Okay, that's a very good question. I mean, I'll talk from my perspective because this happens a lot in surgery, not just when you start, even years down the line when you get a bad run of outcomes. It's absolutely fine to go to the clinical lead or go to the clinical director and tell him, I'm not happy with my outcomes. I'd like an internal supervisor, and you don't need to move out. Yeah. And that's called insight. And that's absolutely fine, especially with challenging surgeries where you're scrutinized and your outcomes, you're just allowed 1 mortality per year for a CABG. You're just allowed 2.5 mortalities for lung cancer resections. So it's very, very critical if your limitations are very tight. And I have, as I mentioned, it's absolutely fine to say, I'm not happy. I feel like this is too much for me. And you may know what the problem is and say, okay, I'm going to take a course in this and that. You may step down. You may apply for another job. It's absolutely fine. That's not a problem. Knowing your limitations is a good thing, but you need to be professional in how you say it. You don't go around and advertise it all over the unit. And you need to have friends, and they don't necessarily have to be in the unit. Now it's much easier. We've got 250,000 Egyptians in the country. I mean, I go to the prayer hall in the hospital, and all I see around me are Egyptians. SubhanAllah. This didn't used to be the case when I started in the country. So you've got a lot of friends. Pick up the phone, go to Egyptians together. You'll find lots of advice, and use that advice. It's very precious. And you have to have someone who you can pick up the phone in the middle of the night and say, I need help.
I'll just add from a medical point of view. Let's say, as we said before, the medicine are more benign than surgery. Sorry, no offense, Mr. Ahmed, but we are more benign. We are more supportive. We don't have this restriction that it seems to be in the surgical. People who have used to say that they are malignant, and it seems they are malignant. But in our specialties, for example, from starting from your interview, if you read your job description, they mention in details what you are going to do in Monday, Tuesday, the schedule, the job plan for you. And if you went through this job plan and you find you are able to do so, you can discuss even in the interview, because you are coming at a local consultant job, so you are discussing with a colleague in the same level. So you ask whoever is running this interview that, okay, I'm happy to do so and so, but I'm not sure about this, how you are doing so. If you had a case like, for example, so and so, where do you prefer these cases? And that's what happened for me, because I was asking about the specific cases which I saw in hematology. And it was like a scientific discussion in the interview, and I felt more confident when I came. And then when you face any trouble, because you have already asked them in the interview if you have faced any trouble, and they felt, oh, it's not the same level I was expecting, or this is something I can't deal with, I'm struggling with dealing it. Then you go, I think we are in medicine more benign, and you just go to your clinical lead that I need shadowing, and you can ask for this even from the first day, that I need to work for the first or 2 months as a shadowing with another consultant to find out the system, to know and get to know the system, and then I'll be on my own. At this 2-3 months, you would be able to judge, am I able to go on with this job or not? If you are not able, just ask them, I don't think I'll be able, I'll just work for maybe 6 months and then apply for another job, or yes, I'll do it with support. And definitely, I'm saying I don't have a percentage, but I'll say more than 60-70% you will be lucky with having a supportive team that go ahead and we are on your path to support you. And most of the struggling, or at least this is my experience, was the administration and the system, not the medical world. So you do fine with your clinic. This is the same. Nephrology everywhere the same. The acute kidney injury or some patient with need dialysis would be the same in Egypt or in UK. It's the same, but it is the system, how the system works, whom to refer, whom to ask for help, when to assess it. This is different, and this is only takes you few weeks if you are a good learner, or months, let me say, and that's it. You're in the track. Which link is not working?
I think they're talking about my web page.
Okay.
Maybe remove the dot at the end. It is working. I've got it open on my laptop, and I've checked it before this, so it is, and it will lead you to my. I'm not sure whether my Google Drive will. It should open it up. I think it's open to sharing. I'll double check it after the meeting.
I'll just add a last comment that for each specialist when apply for a job, it's I'm not saying it's recommended, but it will help you looking for a consultant who had been trained in UK, what exactly they are doing through the curriculum or the job description of the consultant who is working in UK, and you find out if you need to do further courses, for example, or further training in a specific requirement, and then you'll be able to take this course, because most of the courses now are online. It's open for everyone. You are sitting at your home, in your computer, and you get the course. So it's very helpful, and it gives you a good, view when you are applying for jobs. Are we done with questions?
Well, that's the link. That's the direct link. So it should anyone with that link should be able to access it. And feel free to copy the form of the CV. It is a lot shorter than before, but anyway, it's more obviously gauged to surgery rather than medicine.